And as hospitals and healthcare facilities prepare for that annual occurrence, they are also preparing for the new threat of Ebola. Eyewitness News reporter Brittany Sweeney spoke with an infectious disease nurse about how to defend yourself from both. Brittany?
Good evening, Candace and Drew. Medical experts say both diseases can be contracted through bodily fluids, but unlike the flu, Ebola is not airborne.
So you want to protect your eyes, your lips, your nose.
Experts are not predicting a harsh influenza season, but they say you should still be taking preventative measures.
The most preventable thing that you can do besides the hand washing is receiving the vaccine. That actually decreases your incidence of acquiring this virus by 60%.
Daniel Kozar is the infectious control nurse at Timber Ridge Healthcare Center. He makes sure illnesses like the flu stay out of the building.
The proper cough etiquette is coughing into a clean tissue and immediately washing your hands afterwards. If that's not readily available, like for healthcare workers or someone that's walking down the street, you cough into your elbow or use and wash your hands.
But recently, his focus is not centered around fighting the flu. For the past month, the registered nurse has been setting Ebola procedures in place.
Unfortunately, it's very easy for a virus to spread.
Though the virus is not in this section of the country, most healthcare facilities are preparing for the worst.
Education, be proactive, make sure that people understand what they need to do. If people panic, that's when people make mistakes.
Kozar says Ebola symptoms are similar to the flu. His facility now has screenings in place and infection control rooms.
We would immediately isolate the patient according to CDC guidelines, and we would send them to a higher acute care setting that is rarely able to treat for that virus.
Protective gear like this gown and this mask were used by nurses in Texas to treat the Ebola patients, but because they contracted the disease, new equipment that's safer is on its way to healthcare facilities. Gear similar to hazmat suits are on their way to the Wilkes-Barre location. Kozar says he will be ready should Ebola strike, but he feels Americans have a fighting chance.
We as a nation need to better use the tools that we already have to control this virus at the state that's in right now.
Kozar says you are at a high risk for Ebola if you have flu-like symptoms and you actually had direct contact with a person or patient that was in West Africa or a corpse of someone that passed away from Ebola. He says to just be aware of your surroundings. Reporting live, I'm Brittany Sweeney, Eyewitness News.